Now, when we look at the deaths, this is important because this is where all the controversy and excitement and reporting has been. Let me point out that there was one cerebral macrohemorrhage related death that occurred in the randomized study, and it occurred in the placebo group, not in the treated group. So when you actually now add, and all the comments I've made so far are only talking about the randomized study. When we look at the open label study and we add it, we see that there were 2 deaths that occurred with cerebral macrohemorrhage. The first of them was a 65-year-old female ApoE4 homozygote with left middle cerebral artery territory infarction, or occlusion, I should say. This occurred in the open label extension. That patient received TPA, tissue plasminogen activator. My neurology colleagues know that this is a thrombolytic, which means that it has a known complication of a hemorrhage, and a hemorrhage did occur and the patient expired. But it was in the setting of TPA in Lecanemabe. The second one was an 87-year-old female, 87-year-old male, ApoE4 non-carrier, on Eliquis or Eliquis for atrial fibrillation, who had many falls and pneumonia and developed a macrohemorrhage 4 months after initiation of Lecanemab open label treatment. Eliquis was stopped. The patient subsequently, because he had atrial fibrillation, had a myocardial infarction and died from cardiopulmonary arrest. These cases show that the causality with Lecanemab is little difficult. And I understand that people want to say that there's some causality. These things are continued to be explored. So the point here is that the rate of macrohemorrhage is low. It's only 0.6 to 0.7% compared to placebo. It does go up with anticoagulation, and that might be a relative risk that needs to be managed, might need to be discussed. We know that there is no clear relationship between macrohemorrhage and ApoE4 carrier status, baseline MRI, or timing of treatments. And it will be a caution that patients on anticoagulation might need some further consideration.